my first question is about the correlation between ongoing mass protests and the possibility of a new spike. It became public that members of DC National Guard have been already tested positive in COVID. And from your point of view, these cases are only the beginning of the possible mass outbreaks.
Well, I think we have to be careful because we don't know how it's actually going to turn out. But as I have been saying for some time, gathering in crowds is a risk. Gathering in crowds without a mask is an even bigger risk. And when you have demonstrations, even though you can understand the reason and the need to exercise your constitutional right to demonstrate for something that you feel strongly about, my recommendation has always been that one has to be really careful to avoid crowded places. And if you do it, which I don't recommend you do, but if you do, you make sure you wear a mask and keep a mask on all the time. But in answer to your question, obviously, there is a risk when people congregate in a very crowded way, particularly if they're shouting or chanting, that there is a risk that there will be spread of infection leading to a surge of new infections. And that's one of the things we're keeping an eye out on. And it was very disturbing to see that some of the actual National Guard who were there actually were infected, which means that there's the possibility, maybe a likelihood, that they would have infected other people or were infected from other people.
But it appears that vast majority of protesters are actually wearing masks, and that is
Right.
the good news. But there is still controversial information about the efficiency of mask, and moreover, how this, what kind of mask is better for use and better for protection. What is your recommendation concerning this issue?
I think one can say that wearing a mask is always better than not wearing a mask. It may not be 100% protective, but it certainly affords some degree of protection from you from getting infected from someone else. And if you are infected, even if you're without symptoms, it would protect someone else from getting infected for you. A normal cloth covering would be fine. Surgical masks are fine. There's no need to get an N95 mask. We should save that for the healthcare providers who need it because they put themselves in constant risk by taking care of infected patients.
Another issue is about the states who have started for reopening, let's say, and in 19 states there are new outbreaks after Memorial Day. From your point of view, does it mean that we are starting reopening too sharply and maybe we have to slow down a little bit?
Well, I think you have to be careful not to categorize the entire United States in a unidimensional way. It's a very big country, and different states, regions, cities, towns, and counties have different levels of infectious activity. If you're in a county or an area that has very little infection, you can feel comfortable in going and trying to normalize and diminish mitigation. If you happen to be in an area where there's still very active infection, it would not be wise to try and rapidly get to decreasing the mitigation. So I think you can't say one size fits all. You have to look at where in the United States you are. If you're in a high impact area, you got to really be careful. If you're in a low infection area, you could be a little bit more brisk in returning to normal.
And the same can be said about the school reopening as well. It depends on the rule of the state.
Absolutely. It's exactly the same. There are some counties and regions in this country where it would be okay to open schools. There are others where you might not want to open them at all. And there are others where you want to do something in between, like maybe open them but modify the schedule. Morning classes for some, afternoon classes for others, things like that.
Talking about the possibility about the second wave, The chances are unclear, but still people are scared of its possibility. What is your prediction? And if it happens, how can we be more prepared for it?
Well, it's impossible to predict with any degree of certainty what's going to happen. The one thing we do know will happen is that there will be infections in the fall and in the winter. We know that because this virus is so transmissible, it's not going to spontaneously disappear from the planet. We'll have it. Whether or not we have a second wave in the fall and winter will be totally dependent upon our ability and our effectiveness in being able to identify, isolate, and contact trace these new cases when they come up. If we do that effectively, we can prevent a second wave. It is not inevitable that we're going to have a second wave. We can prevent it if we do the right thing.
But to track new cases, we need testing kits, correct? And is there really a testing kit shortage now? And can people who don't have symptoms be like easily tested?
Well, I know that's why it makes contact tracing very difficult. It's not impossible, but it's difficult to do, particularly when you have situations where people are spreading infection, but they're not symptomatic themselves.
Mm-hmm. Their vaccine, everybody is hoping for the vaccine, and I've read that you are optimistic about the vaccine that is being produced by Moderna company. So what are the grounds of such optimism, and are there any others which looks
Yeah.
promising in your opinion?
Yeah. I am cautiously optimistic that we will have a vaccine within a reasonable period of time, not only from Moderna, but from other companies too. They are not the only company. We are involved in collaboration with several other companies. The reason I'm optimistic is that in the early trials in humans and in animals, the results have been favorable. In other words, it protects animals in the experimental stage. And in the phase 1 trial in humans, the vaccine was able to induce a response that was predictive that you might be protective against the virus. So although you never can guarantee that you will have a safe and effective vaccine, and that would be foolish to guarantee that because no one can guarantee that. But we are cautiously optimistic that we're going in the right direction.
And talking about optimism, do you mean that some of people who was tested, they like show these neutralizing antibodies? Am I
Correct.
right?
Correct. And we looked at the phase 1 study. At a moderate dose, individuals were able to mount not only just a plain antibody response, but an antibody response that's what we call neutralizing. Namely, it blocks the ability of the virus to replicate. That's a very good sign when you're looking at what kind of response a vaccine induces.
The third and, as far as I know, the final stage of the Moderna vaccine trial might start in July, correct?
Correct.
And at the same time, the production of the doses will begin before the final results of the trying are available. So, and as you noted, it is developing at risk, correct? Why
That's
such a
right. Well,
decision was made? It's very complicated, I think, and it could cost a lot of money.
right. So the risk is only to the money. It's not a risk to safety, and it's not a risk of compromising the scientific integrity of the study. This is such an emergent and important situation that we, the federal government, is willing to take the financial risk in order to expedite the process and get us to a vaccine months and months earlier than we normally would. So we feel it's worth that risk. If it turns out the vaccine works, the risk was worth taking. If it turns out the vaccine doesn't work, then we've lost money. But in such an emergent situation, we would rather take the risk in order to gain time.
And how many doses are planning to produce?
Well, I think each vaccine candidate would like to produce at least 200 to 300 million doses. And some of the companies are aiming at being able ultimately, not right away, but ultimately to produce about 1 billion doses.
Oh, that is great. Sounds
Yeah.
very, very great.
Well, some of the companies are projecting that they will be able to do that. Each individual company makes a different projection, but some of them are saying that within a year or so they would be able to get 1 billion. Not right away. I don't think they're going to do it right away, but ultimately they'll do it.
This that is record time for the vaccine development.
Yeah,
Previously, 4 years was the fastest time frame, correct?
correct.
And should we be concerned about the major success indicators of the vaccine? I'm talking about efficiency, safety, and durability.
Well, that's what I said, that it is not a risk for safety. All of the safety provisions are going to be enacted similar to others. And certainly, we're going to make sure it's a scientifically sound clinical trial.
And what about durability? So when we will be able to talk about how how long the effect of this vaccine will long?
We, we don't know right now. We'll have to wait and see. Hopefully, it'll be long enough to provide a reasonable amount of protection. If it turns out the durability is less than we like, we could always give a booster shot.
Mm-hmm. But you don't have any prediction for the I don't know number of months now, so we can wait. We have to wait.
We'll have to wait and see, yes.
And if the attempt hopefully is successful, how would the vaccine be distributed to the public? Will we be able just to go to the drugstore, for instance, and buy it like we can do now with a flu
Yeah.
vaccine, for instance?
I think most people will get it if we get a successful vaccine. Well, either through their doctor's office, through pharmacies, or through other distribution centers. The
Uh,
same way we do vaccine with influenza.
mhm. And if, for instance, among all the vaccines that are producing, that are developing now, yes, two will be like on the final stage. Is it possibility that two vaccine for the is it a possibility for existence for two vaccines, or it could be only one at their
Now,
final
I'm
usage?
hoping that it will be even more than two. I hope it will be maybe 3 vaccines or even more. There's no reason to believe you only could have one vaccine. I think there are a number of candidates that look favorable enough that I would be not surprised at all if we had more than one and maybe as many as 3 or 4.
So as many as possible, yes.
Yeah, yes.
I have to ask about the World Health Organization and its statement about asymptomatic patients. I know that there are a lot of media coverage, but still, what is your opinion? And do you believe that asymptomatic patients can transmit the infection as well as symptomatic?
Well, it's not what I believe, it's what the truth is. They can. The data is clear that about 25 to 50% of people who are infected are asymptomatic. We know that asymptomatic individuals can transmit it. We do not know what the extent of that is, but we know that it is not rare. And that was what the controversy from the WHO statement said, that it's a very rare event. We don't know exactly what the percentage is, but there is enough evidence to indicate that it could be an important part of the transmission.
And my last question is more general. Some people believe that the world will never be the same. And do you think there is a chance and, moreover, hope that we will be able to get back to our normal life somewhere where in the future?
I believe so. I believe that our experience with this devastating outbreak will make us be much more aware of the ability of respiratory infections to spread easily. So I think that there will be care, but I think that gradually, it may take a couple of years, but gradually we will get back to normal so that maybe someday you and I could have an interview in person.
Oh, it would be great.
This will end for sure, and we will be able to get back to normal. So what you need to do is you need to stay safe, take care of yourself, When you go out, wear a mask. Don't go in crowds. Where are you physically right now?
In Washington, D.C.
Oh, you are in Washington. So
Yeah.
Washington has a lot of infections right now. So you've got to be careful. Even though we're opening up, we still have a level of infection that we've got to pay attention to.
Thank you so much. Thank
You're
you for
welcome.
your time and for this hope.